BizTech's Health and Wellness Show, where we focus on equipping you with knowledge on health and wellness to help you to ensure a more productive life for yourself, your families, and your employees. Now, the conversation today is about understanding lymphoma. This presenting and content partnership is with KPJ Ampang Puteri Specialist Hospital. Now, to bring an expert lens to this topic, we've got Dr. Nur Adila Anuar, Doctor of Internal Medicine and Clinical Haematology at KPJ Ampang Puteri Specialist Hospital. Dr. Adila, welcome to the show.
Thank you, Brian.
Could you start by giving us an overview of your background and also your training?
Okay, thank you for your kind introduction, Brian. Assalamualaikum. First and foremost, I would like to introduce myself. My name is Dr. Nur Adila Anuar. I'm a consultant physician and also hematologist from KPJ Ampang Puteri Specialist Hospital. So, about my background, I graduated from University of Malaysia in 2007 and further specialized my study in a master in internal medicine. And I think further my journey didn't stop there. I further specialized in hematology training. And after completion of the training, I become a full consultant hematologist and also physician. So I have a special interest in when it comes to malignant or cancer involving the blood disorder like lymphoma and leukemia, and also special interest in the stem cell transplantation too.
Now, Adila, can you tell us what inspired you to be a doctor and also why the special interest in blood cancer?
I think what inspired me to be a doctor, mainly it comes from myself. I think since small, I don't know, maybe my character, I like to help people. And I don't like to see people when they are unwell and so on. So I think the interest comes from myself. I think, and the patient to do this medicine is all come from myself. It just come from the heart to help the surrounding people. Yeah. And hematology, I think also after I finished my master in internal medicine, after underwent a few of the rotation training, I developed this interest because I always have the, I think when you become a cancer patient, there's always a certain hope. So I think by helping them and to go through this process, and of course, eventually our aim is to get the disease cure is one of my most important goals that I want to do in this field of practice. Yeah.
So thanks for sharing that. But let's start, Adila, with the definition of lymphoma.
So lymphoma is a cancer that begins in the infection fighting cells. So we call this lymphocyte. Lymphocyte usually we can find in lymph nodes, in the spleen, in the thymus, in the bone marrow, and also other organs. So when you have lymphoma, the lymphocyte become abnormal, it changes its shape and become out of control. So that is when you develop a cancer called lymphoma.
And there are different types of lymphoma, isn't it?
Yeah, so there are two main types of lymphoma. One is a non-Hodgkin lymphoma. I would say non-Hodgkin lymphoma is the one of the most commonest lymphoma, and the other one is Hodgkin lymphoma. So why they are grouped into these two special entity or group? Because it involves different types of lymphocyte cells. So every type of lymphoma grows at different rate and respond differently to treatment.
Okay, so then let's take a step back and find out what really causes lymphoma.
So I think the problem is until now, despite of many research ongoing, until now scientists couldn't know what are the real causes of lymphoma in most of the cases. But you might be more at risk of lymphoma. I think first of all is age. I think usually the older patient generally we develop non-Hodgkin lymphoma. The younger age group usually are more prone to the Hodgkin lymphoma.
And when you say younger age group, what sort of age range are we looking at for non-Hodgkin's or for Hodgkin?
For Hodgkin lymphoma, usually 15 to 40 years old.
Okay.
Yeah,
Wow, as young as 15 years old.
Yes, definitely. Certain other factors also are prone to this lymphoma, like you have HIV or AIDS, or post-organ transplant, solid organ transplant, because or you are born to have a certain immune disease. So this group of patients are known to develop more high risk associated with lymphoma. So other than that, if you have a weak immune system or immune disease like a rheumatoid arthritis, Sjogren disease, lupus, also carries a higher risk to get lymphoma. Certain viruses also has been associated with this, like Epstein-Barr virus, hepatitis C, okay, and human T-cell leukemia or lymphoma. So some say if you have a close relative who had lymphoma, this carries a bit higher risk. And if you are known to have lymphoma in the past, meaning you have been treated for any Hodgkin or non-Hodgkin lymphoma, so of course that's also one of the risk factor. And also if you have received any radiation therapy prior to this in the past for any reason, it also associated with higher chances of risk of lymphoma. But if you ask me a clear why you get this lymphoma, until now, most of the scientists can't really tell us. Yeah.
Okay.
It's still ongoing research, I would say.
So then in that case, can you maybe give our audience and me especially a guide in terms of what are the symptoms of lymphoma that we should watch out for, that perhaps then should be the catalyst for us to go and see a specialist?
Okay, so if you have unexplained or any swollen lymph nodes or any swollen, like any part of your body which you think is like abnormal, usually lymphoma patient will have a swelling in the neck, in the axilla, and armpit or at our groin regions. And usually cancer, the bad thing about cancer, they always come with painless. Okay, so most of the patients tend to ignore because they thought the swelling no pain, so they don't seek the earlier treatment. But if you think that is something not normal to your body, please come and see a doctor, because abnormal swelling is always something need to be investigated. Other than that, most of the patient develop, we call it like a bee-like symptoms. So some of them have a unexplained weight loss, meaning is unintentional, not because if you go for a heavy diet or gym, but you progressively have this weight loss, significant weight loss. Usually we call like more than 10 kilo over 6 months. And sometimes you have a drenching night sweats at night. You just keep on sweating at night, and unexplained high-grade fever. Other than that, other symptoms is like really not specific, like having a cough, having abdominal pain, itchiness of the body. And bear in mind, all these symptoms actually can overlap, or other diseases also can present the same way. So if you think something not right, please come and go and see your doctor to get a further diagnosis. Yeah.
So Adila, perhaps you can share with us then, if we go to a doctor and you've diagnosed lymphoma, what are the stages of lymphoma?
So I think to simplify everything, we usually stage lymphoma into 4 stages. Stage 1, usually the lymphoma just localized to one area, or lymph node swelling just localized to one area. Stage 2, usually more than 2 groups at the same side of the area, meaning is either above or below the diaphragm. What is diaphragm? Diaphragm is a thin layer that separates our lung from our abdomen. So stage 3, when you have the disease above and below the diaphragm, I mean, you have maybe at the cervical lymph nodes and also at the groin. So we call it stage 3 already. Stage 4 is the disease is already everywhere. It's metastasis to a lot of other organs and so on. So so that's basically the 4 stages of lymphoma.
Now, could you then share with us the treatment options? Because I know that there's some traditional options that people go through, but there are also some new options in terms of new breakthroughs.
I see. Maybe Brian can share with me first what are the traditional options that you heard before about lymphoma?
Okay, so one of the things is basically the traditional option is then chemotherapy, immunotherapy, some medication, radiotherapy, bone marrow transplant, or some combination of that.
Okay, so I think basically, I think to make it, of course, like what I explained previously, I think this Hodgkin and non-Hodgkin lymphoma is different, but to group it in terms of the treatment, like what I think you've done your homework very, very well. I think you mentioned most of it actually. So we have a chemotherapy. Of course, I won't mention specific what type of chemotherapy, depends on what type of lymphoma you have. We have a radiation therapy too. I mean, like usually we use a high energy rays to destroy the cancer cell. Immunotherapy, usually we use our own immune system. There's a certain therapy that use up our own immune system to attack the cancer cell and destroy the cancer cell. And another one is targeted therapy. So we target the targets aspect of lymphoma to prevent the growth. And of course, another one is a stem cell transplantation. But I think to get a detail whether it will be just that chemotherapy, whether it needing a combination, whether it's a must for you to do a stem cell transplantation, I think you need to go and see the expert doctor to explain further when you diagnose lymphoma.
Is the recent advances in stem cell treatments, is that helping outcomes overall?
Yes, definitely. So I think stem cell transplantation, I think has its role since many years. So in a certain type of lymphoma, like if in the relapse or refractory cases, relapse meaning you already cured from lymphoma and the disease come back, and then you need to undergo another round of treatment or chemotherapy. So usually this patient, we counsel them or subject them for a stem cell transplantation. So based on the study done, even I think recently last year I published a study done by me and my colleague. We collected data transplant patient that need to go for transplant. I mean, like the overall survival improved with stem cell transplantation in comparison to the patient that not having a stem cell transplant. So I think, but not all patients need to undergo this stem cell transplantation. So I think we need to know when we need to do this. Usually we only do stem cell transplantation in a relapse and refractory cases.
So Doc, I want to ask you interesting question. There are a lot of common myths about lymphoma. One of the myths really is the fact that a diagnosis of lymphoma is a death sentence. Is that true?
I would say it's definitely not true, Brian, because I think based on the latest study and research done, I think our overall survival of lymphoma has improved a lot. So I would say overall survivor for Hodgkin lymphoma, I think improved up to like 80% or more, and non-Hodgkin lymphoma around 70% or more. So I think this is because of our advances in treatment, and patient has more awareness to come and seek treatment for Hodgkin lymphoma. This, I would say, more than 50% improve in terms of survival compared to many years back. So I think it does give some hope. It's not a death sentence. Yeah.
So Adila, this is interesting because essentially then our outcomes are as good as the numbers from the US, because I got some numbers from the National Cancer Institute of the US. They have exactly pretty much the same 70+%, 73.2% survival rate over a 5-year period. So obviously in Malaysia, we have the specialists. We also have the equipment and treatment in order to ensure better outcomes for the patients. And therefore, in fact, globally, we are matching advanced countries.
Yes, I would agree with that. I think most of the, especially in the Klang Valley area, I think most of the center can treat and support the treatment of lymphoma. So even in a private center, also in a government base. So I would say we are actually not non-inferior than the Western country, but maybe there are more advances, more in like clinical trial drugs in a few refractory cases. But I would say with a good treatment, we can get a good outcome as comparable as other Western country.
Now, any other myths that are there from lymphoma that you want to share with us?
Other myth, besides a death sentence, I think whether this lymphoma, okay, like whether stem cell transplant is a must. Again, I think I already answered that question. No, it's not for all types of lymphoma and not all background lymphoma. So I think this one we need to discuss personally with our treating physician. Another one, I think it's a common myth. Some patients say when you have cancer, not just lymphoma, you shouldn't eat sugar.
Okay.
So I think sugar will help cancer to grow. So I think this is a totally myth lah. Actually, it's not true. So based on the study done, there's no association, direct association. But of course, if you eat a lot of sugar, it can lead to obesity, and obesity itself carries a risk to certain type of cancer, like a colon cancer.
Okay. Dr. Adila, it's been a fascinating conversation, but before we leave, any final thoughts and words of wisdom you'd like to leave our audience with?
So I would say, first of all, thank you for listening to our conversation today. If you think something not right with your body, you have a lymph node swelling, or you have something abnormal, you have unexplained weight loss, or you have unexplained fever, please don't be scared to come forward. I mean, like, go and see your doctor, not to go to other like a traditional practitioner and so on. Because the earlier you come and seek your medical treatment, the better the outcome and survivor.
Now, Dr. Adila, thank you very much for taking your time to be on the show.
Yeah, you too. Thank you for inviting me today for the show.
Now, I'm Brian Fernandez, and we've been speaking to Dr. Nur Adila Anuar, Doctor of Internal Medicine and Clinical Haematology at KPJ Ampang Puteri Specialist Hospital on BizTech's Health and Wellness Show, presented by KPJ Ampang Puteri Specialist Hospital. This video and podcast will be on our various platforms as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks a lot for tuning in.